Good day to each and everyone. I am Faiz di Mangatab Samporna, and the definition of sexually transmitted disease is sexually transmitted disease. This means that they are most often but not exclusively spread by sexual intercourse. HIV, chlamydia, genital herpes, genital warts, gonorrhea, some forms of hepatitis, syphilis, and trichomoniasis are sexually transmitted diseases. Sexually transmitted disease used to be called venereal disease or VD. They are among the most common contagious diseases. It's estimated that 25% of all people have an incurable sexually transmitted disease. Each year, 20 million new cases are reported. Half of these infections are most among people ages to 15 to 24, and they can have long-term consequences. Sexually transmitted diseases are serious illness that require treatment. Some sexually transmitted diseases, such as HIV, cannot be cured and can be deadly. By learning more about sexually transmitted disease, you can learn ways to protect yourself. The common example of sexually transmitted disease are chlamydia, genital herpes, gonorrhea, HIV or AIDS, HPV, public lice, syphilis, and trichomoniasis. The nature of sexually transmitted disease. Sexually transmitted disease are generally acquired by sexual contact. The bacteria or parasites that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bloody fluids.
Sexually transmitted diseases, venereal diseases, which are commonly known as sexually transmitted disease, are infectious diseases transmitted through sexual contact. It is also referred by the name of reproductive tract infections. The manifestation of sexually transmitted disease can have a range of signs, have a range of symptoms, including no symptoms. That's why they may go unnoticed until complications occur or a partner is diagnosed. Signs and symptoms that might indicate an STI include sores or bumps on the genitals or in the oral or rectal area. In some cases, people with STIs have no symptoms. Over time, any symptoms that are present may improve on their own. It is also possible for a person to have an STI with no symptom and then pass it on to the others without knowing it. If you are concerned that your sexual partner may have an STI, talk to your healthcare provider. Even if you do not have symptoms, it is possible you may have an STI that needs treatment to ensure you and your partners have sexual health. Sexually transmitted disease or STDs are infections that are transmitted during any type of sexual contact. Many STDs women do not cause specific symptoms. Common STDs in women include chlamydia, gonorrhea, HPV, genital herpes, and the Zika virus. STDs or STIs can have a range of signs and symptoms, including no symptoms. That's why they may go unnoticed until complications occur or a partner is diagnosed. These are the signs and symptoms that might indicate and remember when STI is going to your body. First is the sores or bumps on the genitals or in the oral or rectal area. Next, painful or burning urination. Next, discharge from the penis. Next, unusual or odorous vaginal discharge. Next, unusual vaginal bleeding. Next, pain during sex. Next, sore, swollen lymph nodes, particularly in the groin but sometimes widespread. Next, lower abdominal pain. Next, fever. And the last is rash over the trunk, hands or feet. Signs and symptoms may appear a few days after exposure. However, it may take years before you have any noticeable problems depending on the organism causing the STI.
What's up mga kaigala? Good day everyone. My name is Jevincent Manaloto and the topic I will discuss is prevention and consequences. Prevention. So to continue the topic about sexually transmitted disease, it must need a prevention in order to stop diseases from sexual activity. So, when to prevent sexually transmitted disease? Before doing sexual activity, one must be aware of the things needed for protection. Talking about protection, how to prevent sexually transmitted disease? The most reliable way to avoid infection is to not have sex. Second is vaccine. Are safe, effective, and recommended ways to prevent hepatitis, which is disease also. Vaccination is recommended for preteens age 11 or 12. Get tested for HIV. Use latex condoms every time you have sex. Avoid sharing towels or underclothing. Wash before and after intercourse. Consider that not having sex is the only sure way to prevent STDs. Remember that being knowledgeable and aware of do's and don'ts in sexual activities will bring you more safer from getting disease. Consequences. So what are the consequences of sexually transmitted disease to an individual? In addition, STDs can cause long-term health problems, particularly in women and infants. Some of the health complications that arise from STDs include pelvic inflammatory diseases, infertility, tubal or ectopic pregnancy, cervical cancer, and parental or congenital infection in infants born to infected mothers. Pelvic inflammatory disease is an infection of the female reproductive organs. It most often occurs when sexually transmitted bacteria spread from your vagina to your uterus, fallopian tube, or ovaries. The signs and symptoms of pelvic inflammatory disease can be subtle or mild. Some women don't experience any sign of symptoms. As a result, you might not realize you have it until you have trouble getting pregnant or you develop chronic pelvic pain. Infertility is a condition where you cannot get pregnant after 1 year of trying to conceive in women. Cause of infertility can include endometriosis, uterine fibroids, and thyroid disease. Men with fertility problems may have a low sperm count or low testosterone. The risk of infertility increases as you age. Tubal or ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. An ectopic pregnancy most often occurs in a fallopian tube, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Cervical cancer is a type of cancer that occurs in the cell of the cervix, the lower part of the uterus that connect to the vagina. Virus strains of the human papillomavirus HPV, a sexually transmitted infection, play a role in causing most cervical cancer. Parental is the period of the time when you become pregnant and up to a year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth; postnatal or postpartum, meaning after birth; Thank you for watching, guys.